You're listening to Mental Health Colorado's Voices for Healthier Minds interview series, where we interview remarkable people doing remarkable work to advance health of mind in Colorado and beyond. Please welcome your host, Vincent Atchity, President and CEO of Mental Health Colorado, and our special guest. We hope you enjoy the conversation.
Hey, good afternoon, everybody. Welcome to the Voices for Healthier Minds interview series. I'm Vincent Atchity, CEO of Mental Health Colorado, the host of the series. And today I'm very happy to have with us as our guest, Dr. Benjamin F. Miller, who I've known for quite some time. And thanks for joining us, Ben.
Thanks for having me. It's good to see you.
Yeah, good to see you too. Well, thanks for making some time. The point of this interview series is to just have an opportunity for our organization to put a spotlight on some of the significant voices for healthier minds that we identify out there in the world, and you are definitely one of those.
Well, thank you.
You so much. Always a pleasure to be in conversation with you.
Yeah, looking forward to this.
Yeah, so I mean, just to get started, and just to situate you in the landscape of things and make sure that people get a chance to know you, you could tell us a little bit about what you're up to these days, and then also talk a little bit about your arc for how you got where you are and what your early experience, maybe even as a special education teacher, did to shape your ongoing trajectory.
Well, thanks, Vincent. Well, it's just an honor to have the conversation. I'm really glad to be able to go here with you. You know, when I was graduating college, I had one of those degrees in psychology that I think everybody got at the time. I don't know why. It's just we thought it was like the cool thing to do, and so a bunch of my friends and I got the bachelor's in psychology. Nobody had any idea what we were going to do with it. So when I came out of college, the first job I got was I was a case manager, and I was given a list of names of kids. And I was supposed to call these kids, go to their families, go to their homes, go to their schools, get to understand them, help them really connect to the system and coordinate care. As a part of that, I got connected to a school that a lot of my kids were attending, and it was a school for kids that were identified as severely emotionally disturbed, which is, for those of you that aren't in the special ed game, it's a category that we give to a lot of kids that sometimes have behavioral issues and or just underlying like deep emotional needs that need to have those needs addressed. So the principal of the school was a psychologist. And after about a year of me teaching, which I had no right to teach, Vincent, like I had my degrees had nothing to do with education. So I didn't know what I was doing. And in one of my classrooms, I was like 3 years older than another kid I was teaching. So it was just blew my mind. So he was like, listen, man, you know, you're doing good in the classroom, but I don't know if this is your calling. And I see you're frustrated with these kids, you know, not being able to thrive because their home lives are a wreck or the systems aren't supporting them. You need to go get more education, which I think was a nice way of him saying, you know, it's time for you to consider something else. So he was a psychologist, and I was like, well, maybe that's what I'll do. And so the rest is history. That's how it started. Now, to be fair, Vincent, and I know you have these stories too, I look back on those kids that I worked with for those couple of years and I still remember their names. I remember what they looked like. I remember the days that they came on Monday and they hadn't eaten or showered all weekend. I remember the trauma that these kids suffered. And that really did start me on a trajectory to, I don't know, to be this guy that's fighting as hard as he can just to make it a little bit easier for people to get what they need.
Well, I think that's a very succinct summary of a career trajectory that spans so many things: clinician, researcher, foundation president, policy advocate, writer. How would you describe the through line, or is it just that the mission keeps finding you in each of these different kinds of roles?
No, you know, it comes down to, so I'm a musician and an artist, like in my
All
core.
right. All
And though
right.
so much of like what I have done in my life has been really built on these principles of both kind of, this is going to sound a little bit out there, Vincent, but like it's like a little bit of jazz and a little bit of punk rock at the same time.
Nice.
So it's a little bit of jazz because I love to improvise and I know my major keys. I know where to go on the neck and do what I need to do, but I'm flexible enough that I can kind of meet whatever moment might be coming my way and then jam to it. But I'm also a little bit of punk rock where, you know, punk rock, one of the key values of punk rock is that it's counterculture. And so I'm very much about going against the grain, trying to figure out a way that we can think differently about massive problems that our communities have been facing. So the throughput is really that, honestly.
Nice.
Now, when I started my career, it was in academia because at the time there were very few people that were clinically minded publishing on policy issues related to integrating mental health in primary care.
Hmm.
I was like, well, let's go there because it was a promising model. It had great data to support it. I had been doing it clinically, and then I saw the value for patients, but nobody was really talking about how you sustain it or how you scale it or how you address it through policy. So it started very early with just the policy leanings. And then because I was able to improvise, I started finding the gaps where there wasn't really anybody else in the mental health sector talking about policy. So I would go and speak to state psychological associations because I'm a psychologist, or I would go and give keynotes for primary care associations because I was the mental health guy. And I kept lifting up the same thing, which is integration is good, clinical care delivery reform is needed, but hey, you guys got to pay attention to this policy stuff over here too. Now, on the flip side of that, the counterculture is still very much a part of what I do now, which is that I have and you could talk to my kids about this. I have a tendency to be able to take any good situation, like we saw Spider-Man last week. I love Spider-Man. I grew up with Spider-Man, but I loved the movie and I had some critiques. I had some common things that I feel like most people would say about a movie. And so I am extremely critical of things that have taken on precedent as a standard or a dominant culture, which may not necessarily be in the best service of the community. And that's where the counterculture comes in.
Yeah, well, and that's a great lead into some of the meat of the matter for our conversation today, which is something I know we've talked about and agree and are like-minded about, and that is you've argued about how we have codified this separation of mind and body, and that's not serving us, it's not serving anybody at all. Tell us a little bit about that separation that is such a disadvantage for our health and well-being. Yeah.
Well, I mean, it's even in the language that we use to have these conversations. When we talk about mental or mind, we in essence are really perpetuating that false dichotomy between mind and body. But in essence, it's about health, whole well-being, where mental health is a core component of that. And you've advocated and argued for that as well. So what happens with policy is that sometimes decisions are made based on current structures, and it's like stacking a problem on top of a problem, where if a policy gets passed that reinforces a structure that is inadequate or insufficient to address whatever that common good may be, then it becomes a problem that I'm going to have to deal with down the line. Mental health has had decades of policy that reinforce the structure of it being siloed, which means that a lot of what I do and you do and many of our friends and colleagues do is that we have to almost like deprescribe policy. We have to get in there and we have to find the policies that need to be removed because they reinforce the things that don't work. And that's like, I mean, that's a full-time job for a lot of people. But unfortunately, what happens to this date is that we still have folks that want to stack on bad, I mean, it may be good policy, but it's stacked on a faulty structure that's been reinforced and codified through bad policy. And so it's a never ending opportunity. I mean, it's why anybody that's watching, listening, participating, if you want to go into the mental health space, policy has got to be a part of your toolkit, no matter how clinical you may be, no matter how research focused you may be. It's just got to, because there will inevitably be a time when you will run into a policy that limits what you were able to do for the person that you're trying to help, for the study you're trying to, investigate, for the fill in the blank. And that's why I just feel like policy is one of these perennial issues that it's never going to go away.
No, it's like a very complex tumor or something like that. I always think of there was an episode of Grey's Anatomy where the lead surgeon was wrestling with a very complex tumor in somebody's spine, and he ultimately had it drawn on his bedroom wall and was trying to plot out how to extricate this mess.
Mm-hmm.
So every move we make is some kind of a weird surgical intervention that shouldn't have to happen and doesn't make any sense
But
at
we have to
all.
have that commitment and that vision to know what good looks like and what it should be. Like the surgeon knows what a spine looks like without the tumor. I don't know if we truly know what it looks like to have a healthy functioning system where mental health is a natural, free-flowing part of that. I don't think enough people have had that conversation. I'll tell you who does know. It's the people living in community that have experienced the system for what it is.
Yeah.
And I'm a big believer and almost like to a fault that the folks that with lived and living experience that should be driving the general direction and policy agendas, delivery reform and redesign, those are the folks that have better ideas than a lot of people that are just kind of, no disrespect to anybody, including myself here, but writing the papers and just talking about it at a conceptual level.
Yeah. Um, just jumping around a little bit,
Yeah.
referring to other things you've talked and written about. You've talked about deaths of despair and Americans dying younger from this whole array of things that assail our health. How does that represent as evidence of this kind of fragmentation of mental health and physical health? Or how is that representative of that kind of policy failure that plagues us?
Yeah. So those that aren't familiar with the concept of deaths of despair, these are deaths to drug, alcohol, and suicide. And it was a term that was coined by a couple of economists right after the 2008 economic downturn. So if you don't remember 2008, there was a significant financial crisis in the US. A lot of folks lost a ton of money, and it led to individuals being out of jobs. We saw a spike in unemployment. Well, at the same time, the economists noticed that there was an increase in mortality. But it wasn't just mortality across the board, it was an increase in mortality due to preventable causes. So they coined the term deaths of despair because people were experiencing despair at a time where there was economic uncertainty, there was a loss of employment, there was financial insecurity and instability. And frankly, there was just this ongoing uncertainty about where we were going to go, how we were going to be able to dig out of this, and what's going to come afterwards. I mean, this is almost 10 years ago that we started writing on this stuff. But I mean, it was in recognition of no one talking about the underlying causes of why we are dying prematurely. Now, concurrently, we saw a decrease in life expectancy. Now, so this is like early 2019, 2020, 2021. We started to see a dip in life expectancy. And so some people were just attributing it directly to COVID because COVID was early in 2020. But the trends actually had started about 20 years prior in the 90s, where we started to see this slow uptick and multiple data points around people dying to drugs, alcohol, and suicide. But then it spiked after 2008. So that's probably way more than you wanted to know. But the solutions to that were largely driven at a multi-systems layer. So it wasn't just the fact that we need to increase access to mental health because that's going to help somebody who's dealing with the loss of job. No, you need to figure out a way to give them a job too. We need to figure out a way to increase treatment for substance misuse and substance use disorder. Well, that's great, but you got to figure out, well, what's causing the demand in the first place? So Deaths of Despair was a different type of platform in which we were able to then have hard conversations around mental health and addiction, but also broaden it to, I mean, honestly, Vincent, like people that weren't even really, it wasn't in their wheelhouse to talk about this issue. So I look back on those reports fondly, and they still do them today. It was a partnership that we did at the time when I was at Wellbeing Trust with Trust for America's Health, which is a wonderful public health organization in DC. They still put them out there, and anybody could go and look at their state and see how well they're doing or not doing. Positive stuff is that we have improved in some of those areas. We saw a small uptick in life expectancy the last couple of years, but still got a long way to go, my friend.
Well, I mean, in that note, you've co-led work on community-initiated care, and that argues that communities are the first most immediate response to mental health needs, and that's so different from building clinicians and turning to the traditional healthcare provider organizations. What does that mean? Give more examples of how community-initiated care is the thing.
So, yeah, I mean, just for a moment, think about the people in your life that you trust to share what's really going on with you. I mean, and I ask that to anybody, but there are people in your life that you encounter that you share things with. And sometimes those moments of sharing, those moments of trust, those moments of just being open, they are the most powerful points for, or an opportunity for intervening and changing the course or trajectory in which we're going. And so community initiated care was really built on the premise of in community, by community, for community. And it was largely driven by these relationships that we were seeing in community. I don't have any hair anymore to cut, but when I was in Denver, I used to go up to the Highlands all the time and see my boy Scott. And Scott and I would talk about all kinds of things under the sun, very hard things to talk about, because he was someone that I trusted and he trusted me. And so now what happens if you trained all barbers to be the new front line? Or for people that might go and get their nails done. You're going in there every few weeks. However often my kids want to go more than they should want to go, but you establish relationships with these people and you begin to talk and share. If you have a favorite pub or a favorite brewery or a favorite restaurant or a favorite coffee shop or a favorite, fill in the blank, these are places that are natural front doors for having a dialogue around mental health. And so community initiated care posits that what happens if we were to equip these people with those skills, not to become clinicians or counselors or any of that stuff, but just to have a little bit more knowledge and understanding of what they could do to help that person. So that's like, I mean, you're a public health guy, you get this. I mean, this is like going upstream without talking about housing and employment and transportation. It's going upstream and meeting people where they are in these beautiful moments of where they're willing to talk. So that's it. I encourage folks that don't know the concept, take a look. We published a bunch on it, and it is a one piece of multiple pieces that need to go into rethinking a continuum of care.
I wonder if you were the one who first introduced me to the work of Dixon Shabanda, who had the grandmother's bench.
Yeah, the friendship bench. Yep. Yeah, that's a great story. Those that aren't familiar, Dixon Shabanda, he's a psychiatrist, and he was working in a remote village in Africa and lost a patient to suicide and was just like, I'm only one. I need to figure out ways to provide more support for my community. And so what he did was he took the training of cognitive behavioral therapy and he said, well, let's give it to the people that have the most trust, which in this particular case were the matriarchs of the village. Started training grandmothers to address issues of mental health with men and others in the community, and it's taken off. And now it's a little bit of a social movement unto itself. But yes, Friendship Bench is all over, and it's a wonderful model.
And that's kind of community initiated care, right? It falls under that category. Yeah.
It is. It's a little more structured and a little bit formal, but yeah, I mean, I'm not training people in bars to do CBT. I'm training them to be like, identify and then provide some type of support and then give behavioral activation is the word I would use, without getting into some of that messiness of, oh, what are you thinking and how are you feeling?
Cool. So you've worked on so many different things, the health integration, payment reform, workforce development, the community-based prevention, all these different levers. If you could just pull one of those, I mean, which one has the highest leverage for impacting the health of the community? Or does it always have to be many things at once?
No. I mean, if we had our magic wands in front of us and we were like, let's wave it and what's going to have the most positive impact on mental health throughout the entire country, it's poverty.
Yeah.
Poverty is such a pernicious driver of many things, including trauma and abuse, including living in conditions where you just don't feel like you've got what you need to be successful. I think that is a single-handedly is probably the first and most important thing that we could do. And there've been a lot of campaigns on poverty over the years globally, and we haven't been able to make that move. But if you want to see the impact of things like that, just look at the positive trends that we see providing like child tax credits. Child tax credits are a really simple policy. They don't give a lot of money to families, but they give enough money to families that families are able to do more, including pay for food and education and other things they may need. When tax credits expire for kids, you do see an increase in poverty.
Yeah.
And so it's I make direct connections to this in mental health because I've seen families that are extremely resilient in the face of abject poverty. And I've seen families that continue to suffer and have that multi-generational, intergenerational negative effects on them. And so I just feel like it's kind of like what we used to talk about in public health in the day. If we could just get everybody to quit smoking, how that would increase life expectancy for the country. I feel like just get rid of poverty and the mental health is going to improve for quite a few people.
Well, it's refreshing and inspiring to hear you calling out poverty so explicitly. And it was like President Johnson or something declared a war on poverty in
Right.
1969, right? And here we are all these years, whatever it is, 50 some years later, and I don't even hear leading politicians using the word poverty as a thing.
Well, it's like we've forgotten about, a quarter of the population in the US. And I mean, this is our generation, but more specifically the previous generation, the boomer generation, they have had the most economic opportunities of any generation that we've really ever known. And so we now have generations of folks, including the boomer generation, that is extremely well off. And so that gap between the haves and the have-nots has only widened. And so now we do have a bigger middle class, but it's almost as if middle class isn't sufficient enough anymore because of how expensive things have become. So
Yeah.
you think about education, you think about cost of groceries and cars, and my family and I had the good fortune to spend some time out of the country this year, and we went to the grocery store just as one example, bought dinner for the whole family that we were going to make at home, and it was like 28 euros.
Hmm.
So even doing the conversion, it's less than, $40. I go to my local Whole Foods and I'm dropping $100 just to buy stuff for dinner. Now, that is more of a indictment on public policy and things like inflation, tariffs, other stuff than it is on anything else. But it shows that how do families, supposed to just kind of achieve this optimal state of health and well-being when groceries are as expensive as they are? It's just you got to make those connections.
Well, and I'm always baffled by the way we formally identify the federal poverty
Uh,
level because the numbers are so out of whack with what everybody's experience in observation is. I can't even remember exactly what it is for a family of four. It's some
it's
scandalously
yeah.
low
So
ceiling.
there's two definitions of for defining what the federal poverty limit is in the U.S. And the one that we use is like hasn't been changed in 50 plus years. And you're right, it is. It's like it's so appalling that I know folks that are coming out with master's degrees making 60, $70,000, which maybe 20 years ago was a really good salary, and they're having a hard time just being able to afford their rent.
Yeah.
So these are big problems. I mean, let's
Yeah.
next time you and I could do this with an economist and talk about all those amazing trends that are plaguing our kids.
Yeah, well, that's a good idea. We should do that. Um, so right now, one of the things that's distinguished about our times is how politically divided we are as a nation. And where our health is concerned, bipartisan work seems critical. How grave a threat to us is this divided state that we're in? And what can we hope for, do you think?
Well, let me lead with the positive,
Yeah.
which is that mental health is always an issue that gets bipartisan support. May have different ways of approaching and tackling that issue, which we can talk about. But it is something that when you look at the surveys and you look at what most folks will prioritize within red and blue districts, in mental health always rises to the top. So that's a good thing. That means we've got kind of a common place to start talking about an issue. Where it is challenging is the solutions that we feel like we need to pursue in support of that issue. And so there's the kind of the policy and the politics of it, and then there's kind of the general community's discourse, which I think, as you mentioned, has become, a lot more divisive, which has led to increased stress for a lot of folks. We used to talk about this every Thanksgiving. I've done like you, I mean, done too much media in my life. And so it felt like every time Thanksgiving was coming around, somebody wanted to talk about how do you handle difficult political conversations at the Thanksgiving table, because families have been divided over this. I think the solution to that is really goes back to something that we've already talked through, that there is no more basic way to connect than to know someone else. And often we enter in through the door of knowing by asking questions around, well, what do you do and who did you vote for? Versus just like, what was that like? Or, you live on my block. just basic stuff, that's just so simple that we are never going to heal as a nation until we're able to kind of recognize that all of us, no matter how much we disagree on things that are really kind of on the side of what matters most in life, we're human. And the central component of being successful as a human is to have connection. And so, I mean, my best friend, who I've known for, 40 years now, he and I disagree on every single thing you could possibly disagree on politically. But I love this man. He was in my wedding. One of his kids is named after me. I mean, we are like best of friends. And yet, when we have the hard conversations around politics, it's always, I respect his point of view, but I disagree. He respects my point of view, but we disagree. And where we find common ground are on issues.
Hmm.
He cares about the mental health and well-being of his community. Okay. And we leave it at that. And that's just a healthy place to be. No, nobody leaves pissed off and upset. Everybody kind of leaves like with a hug and, a handshake.
Excellent. That's right. A great story. So Ben, I've been enjoying your weekly. I think you're writing weekly at the intersection of all of these different kinds of things we've been talking about. A couple of questions for you is, on the one hand, how do you generate this week's topic, and then the bigger question, what stories from the past year you think deserves more attention than it's gotten in the general media or policy space?
Thanks for flagging that. Yeah, it's been a labor of love for sure. Anybody that's a writer understands that you have to have time. You have to be able to really kind of be critical of self. I do two things at once. If I'm driving my kids to school or coming home and I hear a story that just inspires me, I'll write it down, and I might start my Substack on it just for the future. If I kind of am reading something in the paper or I'm on a call and I get inspired because Vincent's talking about whatever, I'll just make a note. And then what I do is if I feel like I can write enough to it, I'll save it as a draft and I'll come back to it when I'm ready. If there's something really timely, like the launch of a new report, um, or there's a policy decision that was made by the administration, then I will immerse myself in whatever that material is. And then it's a little superpower of mine. I'm not as good as some other people, but I'm okay at it, is I can distill it down into what I think is the most important thing that people understand. So I can read the 100-page document. I can say it's these three things. And then I write to that. And I do not, I mean, I still publish in the peer reviewed section. I mean, I still do that stuff, more academic, but I have just found it's such a wonderful outlet, almost like cathartic, to be able just to continue to write about these issues. So that's kind of how I go about my process. Your second part of the question is what issue in the last year I don't feel like has gotten enough attention.
Yeah.
Um, Man, there's so many. The administration and some of the decisions they've made on stop supporting certain federal agencies, I know has gotten a little bit of attention, but the detriment that it will have and kind of the ripple effect ongoing is going to be, I think, felt for a while. Restaffing federal agencies doesn't happen overnight, no matter how many positions there are. You have to have the right people in there. I think that's one big issue. Two, I've been really kind of saddened to see some of the lack of attention to the issues around immigration. This is a major disruptor for not only our kind of the economic heartbeat of America, but also just the trauma, the disconnection, what all that has done for countless families. And especially, I mean, some of my most powerful memories of being in Colorado were going down through the Central Valley, eating lunch at migrant farm camps, having conversations with people, and then imagining their worlds ripped apart because of this. I think that is a huge mental health problem that we just do not spend enough time talking about. We talk about the public policy side of it, but we do not talk about the mental health side of it. And I could talk for days about other things, but those are two that just pop in my head.
No, thank you. Good ones for sure. So we're getting close to the end of our time here.
Yeah.
So to wrap it up, if somebody's listening right now and wants to do something in whatever their capacity is, what is the most useful thing they can do to support our objective of promoting healthier minds across the lifespan?
Yeah. Number one, I'll give you three things. Number one, have a conversation with your family at the dinner table tonight. Just bring up, hey, this is how I've been feeling. I've been thinking a lot about mental health and what it is and what it isn't. And I just think we need to talk more about it as a family. Number two, talk about it at work. I mean, we all go to work and we spend a lot of time with people talking about meaningless stuff, what we watched on TV last night or what sports team did well yesterday. But I mean, bring it up at work. It's a stressful time for a lot of folks that are in the workforce. Have a conversation there, normalize it, make it okay to talk about, like, I'm not feeling great about this. I'm pretty stressed out. The more we sweep that under the rug, the worse it is for everybody. And then number three, just find a friend, somebody that's in your orbit. And, I talk a lot about third spaces and the importance of having a place to go outside of home and work. Go to one of your third spaces, talk to your friend Scott, talk to whoever around issues of mental health. The more that we can kind of broadly distribute that narrative that it's okay to talk about mental health whenever, the more we normalize it. Now, I do want to be careful here because there is a difference between mental health and mental illness. And I don't want to kind of normalize this too much, but I think that just having conversations around how we are doing emotionally and that impact on our overall well-being, that single-handedly could be one of the most powerful things that you do for someone. You never know who might be going through it. You never know how it might benefit you, but it is a way that we can provide some level of connection that could have a positive impact.
That's great. That should be so accessible for everybody. Thank you so much. So Ben, if anybody's looking for your Substack, how do they find you?
Well, I named it Mental Health 411. You can just Google Ben Miller Substack and you'll find it, or Mental Health 411. Comes out every Thursday at 9 a.m. It's free. I think it locks down after a year or something, but yeah, come join the conversation. We've got a really great group of engaged folks that are on there, and tell me what you think.
Yeah, no, I always enjoy it. Thank you so much.
Thank you.
Well, thanks for joining us today, Ben.
Thanks, Vincent.
Yeah, I look forward to the next conversation.
Looking forward to it.
You take care. Have a good weekend.
You too.
Bye-bye.
Bye-bye.
Thank you for tuning in to Mental Health Colorado's Voices for Healthier Minds interview series. We invite you to learn more about Mental Health Colorado's nonprofit and nonpartisan health mission and join our statewide network of advocates, the Brainwave, to stay updated on what's happening in health policy at the state capitol and how you can get involved in passing laws, changing practices, and building a movement to make Colorado a leader in health and well-being. Visit our website at www.mentalhealthcolorado.org for more information.